Hello, my name is Professor Robert Thomas. I'm a consultant oncologist at Addenbrooke's and Bedford Cambridge University Trusts. I'm also a lead in integrative oncologist at UCLH London, and I'd like to present some data we're presenting in ASCO Urology in collaboration with Stacey Kenfield from Southern California and Professor Rob Newton from Australia and various other clinicians in in the UK. So today we're going to really talk about the influence of gut health in men with prostate cancer. And I personally feel it's a subject which has been very much overlooked in the research agenda up until now. And the reason why we're quite pleased with this research is that we involved three patient support groups who very much helped us with the design of the study, what they were willing to do, what dietary manipulations were they willing to take and what they weren't. So it, I think, is very much behind the success of this. And in terms of financial connections, there's none relevant at all. These are over-the-counter supplements which can be made by anyone, and I or any member of the committee has no association or financial association with the two supplements now known as YourPhyto and YourGut Plus. So why do we want men to have more phytochemical rich foods? These are foods which have a lot of color, smell, and aroma. And we know they are full of phytochemicals which have numerous, in theory, anti-cancer properties, from reducing excess inflammation, for improving DNA repair, having epigenetic expression of some of the genes we live with. They enhance antioxidant pathways, not direct antioxidants like some vitamins, and they even switch off antioxidant pathways when they're not needed. They are also potent prebiotics, which help the growth of friendly bacteria in the gut. Now, we know from 13 years ago, we did a study which concentrated these sort of foods, and we saw that we could slow down the rate of prostate cancer progression, but not stop it in men with prostate cancer. So this time we want to look at combining these phytochemical rich foods with probiotics effectively, which for want of a better word, they're the anti-inflammatory or friendly bacteria in the gut with the aim to improve gut health. Now, improved gut health has various mechanisms for cancer. First of all, we know that it helps vitamin D absorption. We know it breaks down the larger phytochemicals I've just talked about into more active biological units. So there's a strong synergy between probiotics and phytochemicals. Also, if you have better gut health, there's more integrity. There's less inflammation, there's less damage to the Peyer's patches, so immune surveillance is improved. But more importantly, it stops toxins leaking into the bloodstream, which elicits a systemic inflammatory response. Now, if you have systemic inflammation, cells divide faster, you have more oxidative stress and lower immunity. And that's sort of like a perfect storm for cancer, which explains why people with poor gut health have a high incidence not only of cancer of the gut, but have increased risk of cancers elsewhere in their body, including the prostate. So we then, for this study, we thought, well, which phytochemical supplements should we use? And we didn't want to use one which we used 13 years ago. So this was very much what we call upgraded. It had extracts as well as whole foods added, which is very unique. It had new ingredients, which has shown some benefit independently for prostate cancer over the years. And essentially, this was made and given to men, which they were very satisfied that they felt this was the most up-to-date nutritional intervention which they're willing to take. And it had other benefits in terms of food technology. Now, in terms of the probiotic, I mean, this is a minefield. There's thousands of probiotics out there, but we basically felt the lactobacillus had the most evidence. They survive the gut acid, and they generally just switch the profile in the gut from a pro-inflammatory to an anti-inflammatory status. The particular ones we used in the study, we also used in two national COVID studies in the UK, and they were highly successful, well tolerated, and men had their significantly improved GI symptoms. So the men in the study weren't willing to be randomized for the phytochemical rich supplement. They felt there's already evidence out there. So that was given to all men at baseline. And then the probiotic was randomized against placebo, 50-50. And we recruited within 6 months. There was very few dropouts. None of the men were on hormones, by the way, and these were all Cambridge Prognostic Group 1 or 2. In other words, fairly low risk. The difference in this study is that most people were having a PSA progression because these are the patients who were referred to the trial from the urologists. So although they were on surveillance and low risk, they were thinking of moving off active surveillance. Baseline demographics were identical, including testosterone levels, whether they're on tamsulosin grade, etc. And they were, again, no androgen deprivation. So in terms of PSA, as I said, most men were progressing, doubling time 18 months. As a group, as a whole, this significantly prolonged by a threefold to 62 months in response to the intervention. In the group who just had the phytochemical supplement, there was a slowing, significant slowing, but in the group which had the probiotic added, there was actually a fall in PSA. And this difference in pre and post was highly statistically significant at 28%. So the addition of the probiotic and the phytochemical resulted in an average fall in PSA, which of course was very welcomed by men. It was well tolerated. There was a little bit of bloating in some men, but overall most people get health, or the symptoms of the gut actually improved, as you would imagine. And now this was interesting and a little bit unexpected, that actually urinary symptoms improved by using the IPSS score self-filled out by 25%, and even there was a small statistically significant improvement in erectile function. You have to, although very pleased and many men were happy, you have to take into account these were self-reported interventions. So change in management, did it change whether men would come off active surveillance? Well, we know a lot of the people referred were thinking of moving on. And actually, at the end of the study, there was only 9 men who actually did then move off active surveillance into radiotherapy or surgery. Now, there was 8 men who chose to do that if they were just on the phytochemical supplement, and only 1 in the combined group. We do feel, however, this is a little bit early. It was only a 4-month study. Men were given these supplements post-trial, and we're going to follow this up over the next year. First impressions is this is significantly altering the management of men on active surveillance, but that remains to be seen. We did MRI before and after the study, and we were pleased to see that there was no man who'd had a pre-PSA, who'd had an MRI progression, had a fall in the PSA. So we didn't feel there was any masking effect. So in conclusion, I feel this data empowers men in lifestyle choices which they can help themselves, particularly the input of phytochemical rich foods such as the ones here: broccoli, green tea, pomegranate, turmeric, and ginger. And it also empowers men, if they wanted to, they could reach out and take some extra evidence-based supplements which were used in this trial. But of course, we would never say you take the supplements instead of doing the diet. We would always encourage the diet. And this is actually the world's first double-blind randomized trial to show that an intervention to boost gut health using this specific probiotic lactobacillus could slow or actually reduce PSA progression. And we feel that there's lots of implications in research going through, and we really hope that this trial encourages more research in this field. Thank you for listening.